অন করছি। লাইভ স্ট্রিমিং শেয়ার করলাম আমি। কাউসার এখন গিয়ে হচ্ছে গিয়ে তুমি আমার অ্যাকাউন্টে গিয়ে ওটা শেয়ার করি।
ভ্যাগান্ড এটা এখনো শুরু হয় নাই।
হ্যাঁ, শুরু হয় না, আমি শুরু করছি না।
আচ্ছা ঠিক আছে।
এখন শুরু করেছে মেন। জাস্ট ওয়েট, ব্রডকাস্ট হচ্ছে।
হ্যাঁ শুরু হইছে।
ওকে, সো এটা হচ্ছে গিয়ে ট্যাগ করে, বিআরসি তে ট্যাগ করে দেন হচ্ছে কি শেয়ার দিয়ে দেবো।
ঠিক আছে।
যদি কোনো সমস্যা হয় দেন হচ্ছে কি আমাকে রিচ করবে, ঠিক আছে? Oh, sir, please share the meeting link in WhatsApp group and other areas.
Hello,
Fine, is that you? Yeah,
this is Robyn.
yes. I made you co-host now.
Great, thank you. Oh, okay, great. It looks like I could share my screen, so I should be good to go.
Not now, 10 minutes to go. Okay, so
Yes,
many
yes, of course.
participants are, okay.
No problem.
You should check out your screen and other things as well.
Would you like me to try to share screen?
Yeah, let's check out.
Sure. Okay, I think you can see my
Yes,
screen, so I think it's working.
yes, all perfect.
Perfect.
If it is possible, close to the mic so that we can avoid the other noise in, I think you are in a room, I think.
Yeah, can you hear me okay?
Yeah, now perfect.
Great.
Yeah, speakers are coming. Speakers, your co-host now. I couldn't find the Niti sir and Janvit Krishna.
Please ensure that there are more co-hosts because I might not be available throughout the whole session.
Yes, sir. The whole hour of it.
নিধি স্যার জয়েন করেছেন সো সাজ্জাদ
Yes.
একটু রিনেম আসসালাম স্যার
আচ্ছা
স্যার আপনাকে আমরা রিনেম করে দিছি
আচ্ছা গুড করে দাও একটু
Sir, Robyn have to go first meeting another person. So if it is possible to allow her to speak first, is it okay, sir?
Yes, I am ready to speak at the beginning. No problem.
Sir,
Can you hear me?
Robyn have to leave early in the meeting. So
Okay.
if possible,
Okay,
okay,
let her speak. No problem.
thank you so much, sir. I think there's 2 minutes left to begin. Let's join in on participants. Kulitsa, I made you co-host now. Okay, have you please rename with the original? Yes, it's fine. Just 1 minute. Organizers, please check that some participants are want to allow to enter into the meeting. Yes, I find Ika. Ika, I made a co-host now. I think we should start. Hello, everyone. Welcome on behalf of Bangladesh Radiantself community and Bangladesh Youth Health Alliance. I'm pleased to welcome all of you to this special international webinar on the occasion of World One Health Day 2025. And first, I would like to extend my heartfelt gratitude to all of our participants who are joining us from different corners of the world. Okay, so our team sent us a esteemed data of participants. Like I can see that including Bangladesh, Indonesia, Jordan, Nepal, Malaysia, Nigeria, Yemen, UAE, the USA, and many more. Okay, so we are a diverse group of gathered here today. So let me tell you first that BRC envisions a world where youth take the lead in combating the antimicrobial resistance and zoonotic diseases through cross-sectoral collaboration. We are dedicated to empower young leaders, promoting sustainable global health, and fostering interdisciplinary partnerships to tackle all the public health challenges of human, animal, or and environmental health. Okay, so our today's webinar theme is bridging boundaries, youth-driven action for a sustainable global health future through One Health. Okay, so these aims highlights the importance of One Health approach in addressing the global health challenges we are facing today. So let me summarize our all plenary speakers today. So first will be Robyn Christine, a public health expert from Canada. Then our advisory the panel, Professor Dr. Mahmoud Hassan Shikdar and Professor Dr. Ibrahim Khalil. Then our chief guest speaker would be Professor Dr. Nitish Devnath, National Coordinator of One Health Bangladesh. Then Dr. Randa Bazi, Jordan veterinarian and public health specialist. Then from young side, we will have Nika Desai, chair of SCOH IBSA, and Dr. Sharif M. Sadat, Regional Director for Asia Pacific at International Federation of Medical Students Association. And we have our waiting guest that from environment sector. It is first that we have invited an environment specialist in this webinar, MD Zahidul Kubir sir from the Bangladesh Forest Department, who will discuss the intersection of agriculture, environment, and One Health, etc., etc. So I hope that we have reached number of participants from environment sector today. So to kick off our start session, so it is pleasure to introduce our first speaker, Robyn Christine, a public health expert, the NTV Alliance from the Canada. Robyn will be addressing the critical public health challenges we face, particularly in relation to tuberculosis control, and will highlight One Health perspectives in tackling these challenges. Robyn, the floor is yours.
Thank you so much for the warm introduction. Good morning to everyone from Ottawa, Canada. So as mentioned, I work as an independent consultant, specifically focused on the fight to end tuberculosis. I've had the pleasure of working with organizations like the TB Alliance, like the Stop TB Partnership, Minexray, and many others. And I've recently founded the Global Sentinels Movement, which is a platform for connecting young people and supporting young people to engage meaningfully in efforts to protect both people and the planet. So I'm just going to move to share my screen and get my slide deck up. Okay, can we see my screen?
Yes, Robyn, your screen is perfect.
Okay, great. So in addition to working as a consultant, the main way that I self-identify is as a global citizen who gives a shit. So Global Sentinels movement is focusing on connecting, equipping, mobilizing other fellow global citizens who give a shit to take meaningful action for people and the planet. I love working with youth specifically because I see youth, Generation Z and younger, as those who are going to bring about the necessary change in the world that we really need to see. And I always put up on screen this little image from Wreck-It Ralph. I'm not sure if anyone's ever seen that movie, or perhaps World War Z, because these two movies and images really, to me, encapsulate what I think the power of the younger generation is. That the younger generation is going to Wreck-It Ralph on existing systems that are no longer fit for purpose to act in the interest of people and planet. And the next world war, although not a war with violence, it's going to be a war of young people creating the change in the world that's required. And we're already seeing this happen all over the world in different countries, where it's the young people who are forcing change in leadership and seeding out corruption. So I'm curious, does anyone know what the leading infectious disease killer is? And I'd like to see a hand. Anyone put up a hand, raise a hand, come off mute, and tell us what the leading infectious disease killer in the world is. And I'm hoping my host can help me see hands and take a hand.
Fine. It's
Does anyone know?
So it will be a one-way presentation from the speaker.
One way? So no engagement. Okay, well, engagement with the audience is always a little bit more interactive and attention-grabbing than just speaking at people. But okay, I will tell you what the leading infectious disease killer in the world is. It is tuberculosis. So a little bit about tuberculosis. In 2023 alone, it killed more than 1.25 million people around the world. And it is the leading killer among people living with HIV as well. TB is curable. It's treatable with antibiotics, although that treatment course is quite challenging and difficult because unfortunately there hasn't been enough investment in what we call research and development to make sure that the antibiotics we are using are keeping up with the disease. So we are actually seeing the emergence of drug-resistant disease these days. And I know that you're all focused on AMR. TB is actually the leading related cause of death within AMR. In 2023, we also saw 10.8 million people fall ill with TB. So I was wanting to ask the audience some of these questions on screen just to have a little bit of an interaction, but I will answer these questions for you instead. So how does TB spread? TB is an airborne respiratory infectious disease. So it's spread through droplets when people cough, sneeze, etc. And the common symptoms are prolonged cough, chest pain, weakness, fatigue, weight loss, fever, and night sweats. And there are different factors that can increase somebody's risk of TB. They include things like having diabetes or being immunocompromised. So co-infection, for example, is quite common. People living with HIV/AIDS are immunocompromised. And if they have what we call inactive TB, they're more likely to progress to active disease. Tobacco use and alcohol abuse are risk factors, as is being malnourished. So the reasons I wanted to ask you all these questions is because one of the key ways to fight and stop disease spread is by an educated population. So wanting to raise awareness and educate people about the disease is a really critical aspect to prevention. With TB, we can also prevent disease through what we call preventive treatment. So if somebody has a latent form of disease, which a quarter of the world's population has, rather than risk them advancing to active form of disease, which makes them sick and can be spread, we can treat them with preventive therapy. So here in Bangladesh, or there in Bangladesh, where you all are, I just wanted to give you a little bit of a snapshot of the current incidence and mortality rate of disease. So you can see on the graph on the right, there's some good news. We're seeing decreased deaths caused by TB. However, incidence, which is the number of new infections in a population, are actually kind of trickling up, which is of concern. And Bangladesh is listed as a high burden country for both tuberculosis, drug susceptible forms of tuberculosis. So that means not drug resistant forms of tuberculosis, and also drug resistant forms of tuberculosis. And knowing that you're focusing on One Health discussions today, I just wanted to make clear the links between TB and One Health. So the World Health Organization recently launched this new analytical framework and knowledge graphs on TB and climate change, because climate change is actually creating conditions that could intensify the global TB epidemic. We also know that environmental factors like air pollution and smoke may affect tuberculosis incidence and outcomes, and outdoor as well as indoor air pollution can cause increased TB disease burden. So this disease doesn't exist in isolation. It follows climate paths, air pollution paths, and it's also linked to animal health. There's something called bovine TB, which is found in cows, and it can spread to humans if somebody consumes unpasteurized dairy products from that cow, or if they inhale contaminated air around the animals, or come in direct contact with the infected animals. So why take action to end TB? Why care about TB? For me, it's because there's such a lack of political will to tackle the leading infectious disease killer in the world that is totally preventable and curable. So despite TB impacting so many people around the world and having a pretty serious global health security threat to it, we do not have enough funding going towards the fight. So we need, estimated by the World Health Organization, at least $22 billion a year for TB prevention, diagnosis, treatment, and care, and only $5.7 billion of that was available in 2023. And again, I mentioned not investing enough in research and development to have the treatments, diagnostic tools, and immunizations we need to fight the disease. Again, massive funding gap there. I also really care about the cause of ending TB because it's a social disease. It's an issue of social injustice. It is an indicator of discrimination, marginalization, leaving people behind, and weak health systems. So this image is actually from a friend of mine, Olia, who runs TB People. And many times when people have TB, there is massive stigma associated with it, with clinicians telling them, don't tell anyone you have TB, because if you do, you will be ousted from your family or from the social group or network. So for me, it's about the lack of political will. It's about the stigma. It's about the social injustice of the disease that makes me want to take action to end TB. So this session is meant to be about youth-driven action. And advocacy and campaigning is my area of expertise. So I wanted to quickly take you through best practices for designing and implementing an advocacy campaign so that you can be effective action takers in the world for a healthier world for all. So when you're designing a campaign, these are kind of the key steps that you want to take. First, you want to identify what you want to change and why. And once you do that, you can develop your key messages. Then you want to explore how exactly to make that change possible. So what policy needs to change? What funding levels do you require? What behavior change might be needed within the population, etc. Then get to know who your targets and allies are. So these are your levers of influence. Where does that decision and change sit? Is it a government level change? And is it federal or provincial or municipal? Is it an individual level change, etc.? And once you know those influencers and targets of your advocacy, start engaging them. And then build out a roadmap of moments and tactics that you could take to try to make the change that you're striving to make. So this would be your action plan. And then proceed, take action, and adapt as needed. So your typical allies to a campaign is really important. It's way easier to make the change you want in the world if there's many people calling for the same thing. So you want to go out there and identify cause-aligned organizations or networks, researchers and academics who are engaged in the topic that you care about, everyday people like you who might also care about the issue and want to be involved. You want to engage media, friends on the inside. So when I mean friends on the inside, those are people that are bureaucrats or civil servants, or perhaps employees of the Global Fund to Fight AIDS, TB, and malaria. And you want to engage them and build a relationship with them. So there's some sharing of intel and information both ways. So tactics. I like to get really creative with the tactics that I deploy in the different campaigns that I've developed and run in my life. And I just want to show you some of those examples so you can start thinking creatively on your side as well. So here you can see a number of people in New York on the sidelines of the antimicrobial resistance high-level meeting. I think that was in 2024 or 2020. Yeah, 2024 at the United Nations General Assembly. And there's a number of us there presenting a petition from the Fast Track the Cure campaign, which was calling on governments to quickly adopt a new treatment regimen for drug-resistant TB, because the old regimens were very long, came with lots of side effects. And if we have something better, we should make sure that people have access to it rapidly. So this petition was signed by more than 15,000 people around the world. And to make the point of the numbers behind it, we printed out this massive Rolodex of all those signatures and presented it at a high-level meeting on the sidelines of the high-level meeting on AMR in New York. In the image on the right, you can see different monuments around the world lit up in red. Every World TB Day, we have a global stunt where we get notable monuments to light up in red. And it provides an opportunity for engagement on social media and also engagement with media, mayors, members of parliament, etc. This one was really funny, actually. That's me dressed as a mosquito during the last Global Funds replenishment campaign, where we swarmed Parliament Hill as mosquitoes on World Malaria Day, asking our Prime Minister Justin Trudeau at the time to invest $1.2 billion in the Global Fund. This is from a Pride parade in Toronto, where a number of different partners in that campaign came together, and we marched together with our signs. And we also had local drummers, so that our kind of marching group was getting lots of attention and interest. Some other tactics of note, this is Joy. He is a survivor of drug-resistant TB, and he was one of the first people in the world treated with that new regimen for DR-TB called BPEL-M. And so this is his story of getting access to that new treatment and what his experience was like with it in comparison to the conventional regimens. So using real-life people's stories is a really important campaign tactic. What you also see on screen here is a collaboration with an author, Maria Smilios. She wrote a book talking about how the first antibiotic for TB was discovered in the US. So of course that aligns really well with the Fast Track the Cure campaign. So we engaged her as an influencer and a champion. And on the far side, you can see a piece of art developed by a TB survivor and artist, Paulina, using different images from chest x-rays taken in Nigeria. So just some different ideas around the tactics that you can be deploying. Another one that worked quite well in Indonesia was they created this little jingle that they posted on social media, and it was a song and a dance with key messages about the new treatment regimen and its advantages in comparison to the old conventional regimens, because we wanted to raise awareness about the new regimen amongst the population and make sure they were sensitized to it so they knew what to expect during that treatment course. And in addition to those tactics, you want to engage with media through op-eds and interviews. You want to be doing lots of social media campaigning and always use a clear campaign hashtag. You want to have meetings with your targets, allies, and influencers that you identified earlier. You want to build the evidence base for the change you want to see. So doing some research or community-led monitoring to support your case is also helpful. And constantly building the movement. So you're pulling more people into the campaign, because the more voices, the more likely you'll achieve change. So I'm going to wrap up here, but just to show you that you should map it all out whenever you are designing a campaign. This is an example from a campaign I recently ran here in Canada ahead of the budget, because some governments are taking short-sighted decisions and cutting what's called official development assistance. That's dollars that go towards the global fight to end TB and more causes. So I wanted to try to make sure that my government here in Canada bucked that deadly trend and instead maintained their aid budget. Unfortunately, that did not happen. The budget came out on Tuesday, but that was my mapped out campaign plan from the launch of my campaign to the end of my campaign. I hope that was helpful, a little bit of an introduction to TB and how it links to One Health, why you might want to take action in support of ending TB, and also how you can develop an effective advocacy campaign so that you as youth are not just sitting here listening to the likes of me, but you are equipped to go out in the world and create that change we need to see. Oh, you're on mute. You're just on mute. I'm so sorry, you're on mute, so no one can hear you. No one can hear you because you were just on mute there.
Okay, now I think I'm audible. So I think thank you so much, Robyn, for that insightful and thoughtful-provoking address. Actually, it is clear that a One Health approach is vital in the fight against TB, which are you named in TB campaign and other public health challenges. Thank you so much for having with us. Uh, so now we will hear from before our chief guest. So we will hear a short, quick message. From Professor Dr. Mahmoudul Hassan Shikdar, advisor of the Bangladesh Radiantself community and the Bangladesh Youth Health Alliance, a renowned expert from Bangladesh Agricultural University. He will provide us with an advisory address. Professor Dr. Shikdar, sir, please.
Thank you, Shajad. I'm very delighted and happy to see all the international speakers and all the participants from home and abroad. And this is an absolute pleasure and honor to be here. As the advisor of this group, actually, we're very delighted to organize this World One Health Day, which observed globally on the 3rd November, is a reminder of a very simple truth. The health of people, animals, and the environment is not three separate stories. It is one shared storyline. When we disturb one part of the system, we pay the price across all three. Over the past years, we have seen this clearly. Zoonotic diseases emerging at the interface of wildlife, livestock, and human. Antimicrobial resistance silently eroding the power of life-saving drugs. Climate change, heat stress, air pollution, unsafe food, microplastics, and chemical contamination reshaping disease patterns and livelihood. These are not technical issues for one ministry or one profession or one project to handle. They are shared risks created by the shared behavior, and they demand and shared solution. For Bangladesh and our region, One Health is not a slogan, this is a survival strategy. We're a very deeply populated country with intense human-animal contact, expanding poultry and aquaculture systems, growing pet ownership, rapid urbanization, and fragile ecosystem. If surveillance systems don't talk to each other, if veterinarians, physicians, and environmental scientists and community workers are not aligned, we lose precious time and data. They delay cost lives, livelihoods, and public trust. We are very happy that this webinar collected and presented by all the international speakers, including Professor Dr. Nitish Devnath, the leader of One Health in Bangladesh and around the globe. From the organizing committee, I thank all the speakers and participants for joining here. We believe that One Health is ultimately about responsibility, responsibility to science so that our decisions are evidence-based, responsibility to equity so that vulnerable communities are protected, not sacrificed, responsibilities to future generation so that inherit ecosystem that can sustain life with dignity. On this World One Health Day webinar, let us commit that we will think together, plan together, and act together so that by protecting one, we truly help protecting all. Thank you very much.
Thank you so much, sir, for the advisory and this from you and invaluable insights, your continued support, One Health initiatives, and to the organization, to this organization actually. And we feel very lucky that when in need, we can easily reach you, and you never delay to respond. Thank you so much. Okay. So now our next speaker, our chief guest, Professor Dr. Nitish Devnath, the National Coordinator of One Health Bangladesh. Sir has been at the forefront of the One Health initiatives in Bangladesh and will inaugurate this webinar session on the significance of One Health in addressing the challenges we face. Sir, we are honored to have you with us.
Thank you very much. Good afternoon, good evening, good morning, wherever you are, and a very warm greetings to all of you when we are celebrating One Health Day. It is a great pleasure to meet all of you, and I was particularly very impressed with the presentation of Robyn, and she has reflected a very important issue that the globe is fighting against. Tuberculosis for a long time, it is yet not been completed. And that fight will continue, and it has been continuing in Bangladesh too. And Professor Siddharth, thank you very much for your inaugural remarks. I am very pleased to join all of you. And, One Health is in my heart. And we started our One Health journey in 2008 in our Chittagong Veterinary and Animal Science University through an international conference in March 2008. And we made a declaration, what we call One Health Declaration for Bangladesh and Chittagong Declaration for One Health. And in that conference, we also launched a new movement, what we called One Health Bangladesh. And One Health Bangladesh is a very open organization, not only for the vets or for the doctors, and not only environment, those who are social scientists, those who are activists, those who are responsible for those who love the planet to be a very safe place. Anybody can be a member of that One Health Bangladesh. And we have been continuing this movement. And during that time, there are other organizations who have been involved with Bangladesh One Health movement, including the government partnership. It is a great moment that, this is the 10th One Health Day that we are celebrating today. It started in 2016, and Bangladesh One Health community has been celebrating these things almost every year. And I'm very happy that young people is coming up with their strength, with their enthusiasm, with their commitment to celebrate One Health, and not only celebrating the One Health Day, but also to participate in the activities that we are really trying to promote and propagate. I am always a believer of the strength of young people. And I quote in many, many meetings that, the quotation of the then UN Secretary General, she said that you are never young, you are never too young to lead, and we are never too old to learn. And you are demonstrating that strength, that you are taking initiative to celebrate the One Health Day. The world as such, it is not only in Bangladesh, globally, we are in a very critical juncture. There are a lot of potential promises, technologies, prosperities, a lot of things are in front of us, a lot of optimism. On the other hand, we are also in a phase of a lot of critical challenges. One of the most important critical challenge is the health. And when we talk about health, we have seen the COVID, a pandemic, and a lot of other critical issues are coming up, including what we call the three uh, and natural crises, the air pollution, loss of biodiversity, as well as what we also think about the climate change. And those all together, not only the infectious diseases, as a whole, if we want to keep our planet safe for us, for our future generation, then we got to work right now. And for that thing, the power of one will have to be utilized. And One Health, when we talk about One Health, it means we unite all the strength of human resources, the spirit of humanity, as Sigdar already mentioned in his inaugural remark. The One Health has 5 principles. One, the first one is we call equity, then we call parity, then we call ecosystem equilibrium, and the fourth one is the stewardship, the responsibility in other words, and the 10 disciplinarity. Those are the 5 pillars of One Health movement globals, and we need to really share those values. And for that thing, we need to come together, demonstrate the power of one, the unity. And the definition of One Health that you all know, it is a unifying, united approach. That is, and never think, it is a sort of optimizing the health of human, animal, planet as a whole plant and the whole ecosystem. And I believe today we all are here together to promise not only to other one but also yourself that let us keep our world safe by working together. And when we say together, we mean in our work, in our thinking, in our skill, and in our future thinking, we will work together. And I would like to really appreciate the organizers for uh, taking this initiative to organize this webinar. And I can see a lot of participants from different parts of the world. I congratulate all of you. Let us work together and would like to really achieve a goal that is not that is very ambitious but not impossible. And One Health is one of our inspiration. With this word, I would like to thank who has invited me for me. Thank you. And many, many thanks to all of you. I wish you all the best. Thank you very much.
Thank you so much, sir. Your words are really mean to us. Thank you, sir. That's an enlightening speech. Your leadership in the One Health movement in Bangladesh is really, really, truly inspiring. And we're at the learning stage, but we really follow you in One Health. So then, audience. So I think now we would like to move our next speaker. But before it, I would like to show you something that our engagements in One Health and our activity as a youth health initiatives and organizations. So actually, what we are doing. So I would like to see all of us that BRC actually uh, okay, so now I think my screen is showing. So we recently organized the World Rabies Day 2025 with the collaboration of different private sectors, pharma and farm. We actually hope that we can vaccinate to 2,500 straight of vaccination campaign, and for that we need all of your support. In this campaign, we did by the act work and promote our next we are we need more volunteers for our mass rapid vaccination campaign. So here are the QR scan code. You can scan the QR code and join our movement. And as you already know that we did so many initiatives. We did World Zoonosis Day campaign 2025 with a lot of participants. Then we came to organize this webinar, and we get the confidence over it. Okay, so now in future we have a new series of campaign which is called Rabies Hunters, with a collaboration of Rabies Hunters with BRC, Bangladesh Radiantself Community, and Bangladesh Youth Health Alliance. So we are actually doing the different parts of the world and different parts of the country. Actually, uh, we try to our primary school going childrens and all the local community people, so that we can make some impact in the society. Okay, so now, next, we are pleased to welcome Dr. Randa Bazi from Jordan, a veterinarian and public health researcher specializing in antimicrobial resistance through the One Health approach. Dr. Bazi has conducted, let me tell you first that she has valuable research on the attitudes and practices of veterinarians in Jordan regarding AMR, and she advocates for stronger veterinary antimicrobial stewards through One Health Alliance Jordan. Dr. Randa, we are eager to hear from you for your insights. Please take the floor.
Thank you so much for your great and for introducing me to our future One Health leaders from all over the world. So welcome everybody, and happy One Health Day. Can you see my screen?
Yes, your screen is perfect. I think you should move on.
But before just sharing my screen, I'd like to thank you for inviting us, One Health Alliance Jordan, to celebrate with everybody around the world. And this is a special occasion, the One Health Day. And it's also my pleasure to be a speaker with you awesome people. Thank you so much, Radiantself, the change makers, the One Health leaders, the future One Health leaders from all over the world. Can you hear me?
Yes, you're audible.
Awesome. And please accept my apology that I'm not turning on my video, because I don't want my network to be interrupted during the presentation. Again, thank you so much, everybody. Good morning, good evening, good afternoon from all over the world. Thank you so much for attending today's webinar and being part of this great celebration. I'd like to introduce before moving on to talk more about antimicrobial resistance in One Health approach. I'd like to introduce you myself. My name is Randa Bazi. I'm a veterinarian and I specialize in public health. I'm presenting today One Health Alliance Jordan, as well as the One Health Social Sciences, Food Safety and Food Security Working Group with One Health Commission in Washington, D.C. I'm also part of the first cohort of the quadripartite working group on youth engagement for AMR, and also they had extended, I'm also in the next cohort, in the second cohort, a member. Also a mentor with the Women for One Health and the Global Health Mentorship, and I was also a member in the Yalla Fast with the FAO, food security leaders in the MENA region. So before talking about antimicrobial resistance, we must understand and just understand the main keywords which are related to the holistic and interdisciplinary approaches which are one of the most important examples of the holistic approaches are the One Health, Eco Health, and Planetary Health. Then we're going to discuss AMR. I'm not going to repeat my colleagues, the awesome presenters, Dr. Robyn and I'm sorry, I couldn't spell the second speaker name. They talk about more about One Health, but also she mentioned Dr. Robyn how the campaigns in general and the TB as an example, and then we will briefly discuss the role of veterinarians in tackling antimicrobial resistance. So there's a lot of holistic and several holistic and interdisciplinary approaches that work with the human-animal environment interface. The most influential concepts are the One Health, Eco Health, and Planetary Health. So we need to understand them, that they are interdisciplinary. So whenever you need to mention these terms, you must mention that they are interdisciplinary. Okay? That's the most important keyword. So I'm a human being living alone by myself. So it's an individual health or the human health. Then when I'm a group with a group of people, we're public health. A public health inside of a certain community, then this community is part of the global, is part of the global community. So we're gonna move on to another term, which is global health. And now there is One Health. I'm interacting with the animals, I'm interacting with the plants, I'm interacting with the environment. So this is One Health. Eco Health, there's going to be more social behaviors, more well-being. So it's an eco health. Then there's a planetary health, another term. We need to add more things related to politics, more things related to economy. So that's planetary health. Why we should understand more the holistic approaches? Because whenever I want to write a paper related to One Health, I need to understand the terms which are part of One Health, okay? Okay, let's start with One Health. One Health is an integrated, so interdisciplinary, and it's an approach, okay? It's about balance and optimize the health of people, human, and ecosystem. So from this point to understand, it's all about health equity. It's not about only my health. I'm not living alone by myself. I'm living with other creatures, okay? So One Health promotes a cross-sector collaboration across health, food, water, energy, and environmental sectors. The core values is to respect the scientific specialties. So why there is more advanced holistic approaches terms? Because we need to, because we must respect each specialty related to each problem, okay? So whenever we discuss One Health, it's about the respect for scientific specialties while emphasizing the need for the cooperation between such disciplines, okay? Which are the human, animal, and plant environment health. The main core is built on, the main core of One Health is all about coordinating, communicating, and collaborating, the 3 C's. How we're going to achieve the One Health approach by coordinating, communicating, and collaborating, okay? In order to achieve the best health outcomes. So what are the scientific specialties that are working under the One Health umbrella? For the human health, there's public health, human medicine, molecular microbiology, health economics, social sciences. And as for the veterinarians who are working in the animal health field, and for the plant and environmental health and ecology. Now we need to talk more about the term which describes the involving of a human, animal, and animals and ecosystems, which is the eco-health, the environmental sustainability, and the socio-economic stability. Okay? So whenever we discuss eco-health, it's more broader than the One Health, and we have to talk more about the biodiversity, how all living creatures are living together, Even I need to understand how the parasites are living with other creatures, even the unicellular organisms, okay? And everybody must be protected. So for the eco-health, from the human sector, there's public health, the human medicine, there's rural and urban development and planning, social sciences, and also there's anthropology. For the animal health, the veterinarians plays a critical role, and for the plant health, there's a conservation and ecosystem management. Okay. Now, may we turn on to other term, which is the planetary health. The planetary health, it's more broader. Now we need to achieve the highest attainable standards, health, well-being, equity, okay, worldwide through paying more attention to the human system, political and economic. So now we are discussing more terms related to politics, okay? Now, since it's more broader, for the human medicine, for the human health, there's a human medicine, economy, energy, and natural resources. And for the animal health, there's more agriculture sciences. And for the ecology, for the plant and the environment, the ecology, okay? Other environmental sciences, such as the climate and biodiversity research, marine sciences, and that's it. Now we would need to talk about antimicrobial resistance in One Health approach. I guess that everybody now understand what we mean by One Health, okay, and why we can tackle antimicrobial resistance by One Health, by implementing One Health approach. Mr. X, he's a healthy man, and without, he's not diseased, he's not sick, he's a healthy man, and okay, he decided to take some pills without the prescription of the doctor. Also, there is another cow in another farm, okay, just treated with antibiotics, okay, and then slaughtered without taking attention to the withdrawal period of the medicine. Haha, and now, yeah, in Arabic, ya salam, the microbes become more happy, and there is more antibiotics without any overuse and misuse of antibiotics, and the microbes become more resisting for those antibiotics or antimicrobials. Okay. So when the antimicrobial resistance happens, when bacteria, viruses, fungi, parasites change over time and no longer respond to medicines, making infections harder to treat and increasing the risk of disease spread, severe illnesses, and death. So whenever I need to work on an antimicrobial resistance campaign, I need to understand, well, the terms which are related to One Health and the main terms which are related to antimicrobial resistance. It's not about using any complicated English or any or more deep conscientious language. It's all about understanding the basics, using slow language, so whether your language is in Urdu, in Arabic, in English. So everybody, especially if you are targeting the community, everyone must understand the basics, okay? So it's a global health challenge because it's an silent pandemic. Okay, a lot of COVID-19 death cases were related to antimicrobial resistance. Even a lot of non-communicable diseases, death rate related to antimicrobial resistance, such as cancer. Okay, antimicrobial resistant germs, because they can spread through communities, food supply, healthcare facilities, and the environment, the soil and water, which are making it harder to treat certain infections in animals and people. So it's a traveling disease, It's traveling from low to high income countries to middle income countries all over the world through the food supply chain and even through the transportation. Okay, when the bacteria acquire any resistance to antimicrobials, they also acquire a greater ability to proliferate in the animal's human and natural world. It's all about the mismanagement of those antimicrobials. So the community must understand, and as an attendee must understand, it's all about the mismanagement. And there's an inadequate infection control. There's an agricultural debris, contaminants in the environment. So here we are talking more about One Health approach. Even though the migration of people and animals infected with resistant bacteria facilitate the spread of resistance. That's it. Okay. This is just a figure, just show you all some people how the antimicrobial resistance is traveling from Mr. George here when he's overusing and misusing the antimicrobials, and then through the health facility, through then the resistant, how they are spreading to other patients, through the healthcare providers. Even here, there's another arrows which are related to how the antimicrobial resistance is spreading from the animals through the food supply chain to Mr. George and his family and the other community member. Okay, whether through the drug-resistant bacteria remain on meat, or the residues, or the fertilizers, or water-containing animal feces and drug-resistant bacteria. So we need to promote more One Health solutions to antimicrobial resistance, involves collaboration, collaborative approaches across human, animal, and environmental health sector. By raising awareness, community awareness of antimicrobial resistance, Dr. Robyn showed you all some people the main tactics. So I'm not gonna repeat that. We are gonna talk more about how controlling. It's gonna be an exercise for the participants. We need to control the behavior changes which are related to antimicrobial resistance. Many types of behavior drive antimicrobial resistance within the healthcare, and as was mentioned in the previous figure, and in the community. For example, I overprescribe those antibiotics, or patients are not using antimicrobials as prescribed. Come on, because that's okay. My neighbor is just, I can share my neighbor's antimicrobials, so that's okay. Changing such behavior can prevent the further emergence of spread and the spread of AMR. So due to the importance of this problem, WHO flagship the antimicrobial campaign during the World Antimicrobial Awareness Week from the 18th to the 24th of November. Now I need, and I would like to ask from the awesome One Health leaders, this kind of activity, we had worked on it here in Jordan. This kind of activity, we asked the community how we can promote awareness to tackle antimicrobial resistance in our community through 3 main capsules. So the first capsule, it's the human health, and there's the red capsule, it's the animal health, and the green capsule, the plant health or the environment health. So now we have 3 capsules. Okay, and we asked the community members, please describe to me how we can, what are the main reasons, what are the main reasons which raise the antimicrobial resistance issue in the human health field, for the same thing for the animal health field, and the same thing for the plant and the environment health. So we asked our awesome leaders, and it was a great workshop. And then we asked them, please share with us what are the solutions for each sector. So in this way, we are showing the people and the community member how we can implement One Health approach to tackle and to address antimicrobial resistance in their own language, and in the way that they are seeing the problem they're seeing that One Health, they're seeing antimicrobial resistance in their own community. So they're sharing their own thoughts. That's the most important thing. And not just about just giving a lot of presentations without discussion, without any interactive activity. So I'd like to ask the attendee, please scan the following QR code and share with me your thoughts. I will share the link later on in the chat once I finish. So that's going to be at a simple and with high outreach to your community member. Quickly, I'm going to discuss with you one of our previous study, which is the role of veterinarians in Jordan to tackle antimicrobial resistance in One Health approach, which aims to evaluate the role of knowledge, attitude, and practices of Jordanian veterinarians in combating antimicrobial resistance, and also it included the registered veterinary drugs between 2017 and 2020. The study is in descriptive data was collected using a standardized questionnaire focusing on knowledge, attitude, and practices of Jordanian veterinarians. The number of the Jordanian veterinarians, we are around maybe maximum, imagine, for the country with a 10 million. With a 10 million, the population is around 10 million per people. There's only 5,000 veterinarians. The results showed that the main knowledge of the participant who agreed with the statements related to antimicrobial resistance definition was around 84%, and it's similar to other countries such as in Nigeria and in India. The majority agreed is around 96% that antimicrobial resistance is a challenge for the veterinary sector in Jordan, and it should be prioritized among other zoonotic diseases. The most common practice among the veterinarians was recommending clients, whether farmers, owners, to practice good animal husbandry. Okay, let me, because I don't want to go through a lot of details. In conclusion, implementing antimicrobial resistance continual education program is the most important thing in order for the veterinarians in order to enhance their advisory skills. Why? Because I need to enhance the advisory skills of the veterinarians. It will give to achieve also achieve better results with the community whenever I want to work with the community to raise awareness toward antimicrobial resistance. Also, there's another point was highlighted by the research that obligating legislations that exclusively authorize the veterinarians, not any other professionals, such as not allowing the quacks or the fraudulent to be part of the for prescribing antimicrobials and under their supervision, especially for the reserved groups. Okay, and developing a surveillance system to monitor the antimicrobial consumption and to include the data of zoonotic antimicrobial susceptibility tests as they are needed. And now I would like to thank you, awesome people. I guess that I'm finished. Yes, thank you so much for paying attention and listening to me. Thank you so much, and thank you for your time.
Thank you, Dr. Anna, for your commendable presentation. The work you are doing to address AMR through the One Health approach is truly, truly inspiring. I actually joined one of your previous session, and believe me or not, the youth learned from you in a fun way. And it was leading session for the youth. We look forward to future opportunities for collaboration from BRC with Jordan One Health Alliance. So wishing you continued success in your important work. Okay, so
thank you so much, Dee, and also it's our pleasure. And maybe I will share later on with you an email how can the other our attendee can be part of our AMR campaign. And we had hosted also a lot of webinars and the classroom. We have our own classroom. They can join us. And again, thank you so much. Thank you.
Thank you so much. Audience, next we are pleased to now this session will be for the young leaders, the young advocates. And next, we're pleased to welcome from the young side, Eka Desai, who currently serves as the chair of IBSA Standing Committee on One Health and is a former president of IBS India. And Eka is also a student ambassador for the World Small Animal Veterinarian Association, One Health Committee, and has developed her passion for the One Health approaches tackling zoonotic infectious diseases. So, Eka, we look forward to your thoughts.
Hi, am I audible?
Yes, you are.
Okay, great. Thank you so much, Sajad. And thank you so much, Bangladesh Youth Alliance and Bangladesh Radiantself community for having me here today. It's an absolute honor. I will not switch on my camera right now because I don't want the internet to mess up. But if you can see my screen, just let me know.
Yes, your screen is shown.
Okay, thank you so much. So, hi everyone. My name is Ika Desai. I'm the chair of Standing Committee on One Health. And today we'll be talking about very much what is the theme of our today's entire event: bridging boundaries, youth driven action for a sustainable global health future through One Health. Now, when we talk about bridging boundaries over here, I don't just mean the animal, human, and environmental health, but boundaries are also the physical boundaries between nations. Today, we are here from various nations. I'm from India, you are from Bangladesh. We have people from Nepal, Jordan, Canada, like all over the world, even from the sub Saharan Africa. We have students and doctors from all over the world. And this is what actually is bridging boundaries. And not just in the animal, human, and environment sector, it's just us together fighting for a cause, fighting for a reason. And it's really nice that we are encouraging today's youth who will be in charge of the future. So, yeah, a little bit about me. I am in my fourth year of veterinary studies. I studied in Mumbai Veterinary College. I was the president of IDSA India, that is International Veterinary Students Association of India. And I am currently the chair of Standing Committee on One Health and also a SAWA student ambassador for the One Health Committee. What I really enjoy doing and have volunteered in is Mission Rabies, anti-rabies vaccination drives, community engagement, WES workshops, and volunteering at GCT, that is Jeevdaya Charitable Trust, PFA, that is People for Animal Hospital, and interned at Center for Comparative Medicine at Harvard Medical School, which is where I actually found my passion for One Health. So, Dr. Razi already told you all about what One Health is, so we are not going to talk about that, but we are going to talk about the One Health and concept of climate change and ecosystem health. You know that climate change affects biodiversity, accelerates disease patterns, food security, public health. And I will not bore you with the list because the list is never ending. There are many challenges that we
You must be facing some network issues. Please for a moment.
Sorry, can you hear me? Did I get disconnected?
Yes, perfect now. We can move forward.
I did not get disconnected, right?
Yeah, for a moment, it will be no issue.
Okay, okay. So WEC, volunteering, education, collaboration are the main important things that we need to do as the youth right now. Volunteer for anything and everything as we are
Yeah, your
Asians,
screen is not
most of
showing.
us
Could you
over
please share
here,
again?
or from the Middle East and Northern Africa or Sub-Saharan Africa. We have a lot of zoonotic not showing. Okay, okay.
Now it's fine.
Can you see my screen? It's
Yes,
fine?
yes,
Okay.
absolutely fine.
Okay. Thank you so much. So volunteer as much as you can. You will think, oh, but this is not related to One Health. No, everything around you is related to One Health. There is like even the little thing that you do. Beach cleanups, of course, related to One Health. You go around in communities preaching, telling them to stop bursting firecrackers during Diwali. That is also One Health. Every single thing that you do not, if you do not litter in the oceans, in the streets, that is also somehow contributing to the overall health of the society. Anything and everything that you do is somehow directly or indirectly connected to One Health. So volunteer as much as you can. Education not just for yourself but you educating other people. We are all here professionals interested in One Health. There are people who don't know about this concept. They do not understand zoonotic diseases. They do not understand how climate change can mitigate and cause increase in the risks of zoonotic diseases from wildlife to humans. They understand. It is our job to make them understand that. You can do workshops, you can do awareness.
It's facing some issues with the network.
I think my screen again stopped sharing. I will share again. So as I was saying, collaboration is super important. At the end of the month, there is going to be a global AMR Youth Summit, which again has IVSC, that is veterinary students, dental students, medical science students, the pharmaceutical science, agriculture science students together having a global summit. That is what collaboration is, and that is what you need for the future. That is what we need to compete to compete climate change, to compete all zoonotic diseases, to combat TB, for example. We need the youth to be charged up about this. We are the future now. It's not that youth doesn't have loudest voice right now. So use that voice for ecosystem health and zoonotic disease. A very common problem in our countries is improper waste management and increase in dog bites. You may think, oh, it does not go hand in hand, but it definitely does go hand in hand. And now, how do these two go hand in hand? Now, improper waste management will cause the strays, the dogs, to come towards the area where there is a lot of garbage. They will find food. Wherever there is food, where there are too many dogs, they will procreate and increase in stray population. Wherever there is a density of stray animals, you will find an increase in dog bite cases. Now, the governments spend a lot of money in proper waste management, but it is not helpful as much because wherever there is garbage, you will find stray animals. And it's very difficult for the higher authorities for some reason to understand that uh, you need combined budgeting for human animal relation. You do not, we cannot say, oh, there is no relation between increase in stray population and waste management. There is a direct connection. You are spending a lot of money on waste management, but if you do not control the population, you will never have proper waste management. And if you do not have a proper waste management, you have more population of dogs and also increase in dog bite cases. And not all dog bite cases cause rabies, but it definitely the rabies cases in that area will increase. Now, a lot of these big companies like Google, Microsoft, they have funds and budgets allotted to nations for climate change, for ecosystem health, and which also includes waste management. But they do not allot money for animals, for population control of animals, because they think it's not necessary, and climate change right now is a very in topic, it's very trendy. But if you tell them this connection, how the animals, the waste management, and is also uh, causing increasing dog bite cases, you are basically killing two birds with one stone. By controlling the increase in population of strays, you can kill two birds with a single stone. But we as youth need to preach this. We need to make our voice heard. Right now, no one is understanding this correlation, this interrelation. They think these are just two separate things. They are really not. They are really not two different things. So right now there is no combined human animal budgeting, but we do need that in the future. I hear many people saying, many of my foreign friends saying, from Nepal, from Bangladesh, I have friends saying, oh, the government does not allot enough money for controlling stray animal population. But if you make the governments understand this Venn diagram, maybe things will change. They will get what they want, that is clean cities, because they want clean cities, which of course you want clean cities. It's a very visible thing and it's a necessary public health you because we I'll share my screen again. Sorry. As I was
I think we cannot hear.
saying, the cause of eliminating dog-mediated rabies per dog is very less as compared to managing the post-exposure money. So India spends more money treating people after dog bite than it would cost simply vaccinate dogs. It would be prevention is better than cure. And prevention of rabies is much, much cheaper and perfectly aligned with the One Health approach. Now imagine this. This tap is the dog, the leaky pipe is the rabies virus, and you are wearing a raincoat. You are spending a lot of money on raincoats and umbrellas to protect yourself from rabies. What could be
Really nearly ending with a gun. If she could, she don't come back again, and
Hello, am I audible?
yes, you are.
Oh, now I'm audible.
If possible,
What was
we
the
could
last
share
thing
this
you could
screen.
hear?
If possible, we can share the screen of yours.
Yes, that would be amazing. Thank you, Sajjan.
Yes. I think that would be more engaging. Okay. So the role of youth is important.
Can you go to the last slide? Were you able to hear the last slide?
Yes.
Or before that, before that?
Yes.
I think this is where we stopped. Did you all see this slide or no?
I think the slide is up.
Okay, so basically we shut the tap. We control the dog population, ARV. We have no more leaky pipe and rabies gets eliminated and we all are safe. We all don't need the umbrellas and the raincoats, which we need now. Okay, Sajjan, next slide, please. So this is a quote by Dr. Luke Campbell, the head of Mission Rabies. If enough people cared today's rabies deaths would be tomorrow's history. And I really want everyone to take this home with them because it really inspired me, and I really hope this quote inspires you as well. Next slide, please, Sajad. The role of youth is important because you are innovative, you have fresh ideas, you are energetic, you like to network in this multidisciplinary One Health approach. Youth movements have shaped climate activism more than anyone else. Policy making and your voice matters. Remember this. Next, please, Sajad. Conclusion: your voice matters, but your actions matter more. So don't just yap, but also do something meaningful. Go for these volunteering programs and be the change you wish to see in the world. Next slide, Sajad, please. I think that's a thank you. Thank you, everyone, and thank you, Bangladesh Radiantself community and Bangladesh Youth Alliance, for having me here. I know my network was very bad, but thank you for handling that so smoothly for me. Y'all are amazing, and y'all are doing an amazing job having this entire panel discussion and celebrating One Health Day. If you want to follow IVSA and IVSA Global, please can. Thank you so much.
Thank you, thank you. I think there is a little bit issues with the network, but the presentation was excellent. Your work with IBSA and your dedication to engaging youth in One Health movement, especially you are working with zoonotic threats, is truly commendable. It's actually familiar with our motive, and it's clear that youth-driven initiatives will play a crucial role. What she is trying to say with us that a crucial role is shaping the future of One Health. We look forward to the opportunity for further collaboration and hearing for more thoughts and reflections from our audience on how we can collectively advance in this important cause. Okay, so now thank you, Ika. So next, we are honored to welcome Dr. Sharif Mahmoud Salat, the Regional Director for Asia Pacific at the International Federation of Medical Student Association and a founding member of WHO Southeast Asia Regional Youth Council. Let me tell you first that Dr. Sadat is a strong advocate for One Health approach. Through his leadership, he was empowered youth to take active roles in global health advocacy. So, sir, please, we are eager to hear from you.
Hello, thank you so much. Let me share my screen first. Can you see my screen?
Yes, it's smoothly fine.
All right. Hello, everyone. Thank you so much for inviting us and for the fruitful discussions today. I was hearing to some discussions from our colleagues where I feel like this evening we invested in learning a bit about One Health and how, as youths, we can have our role in One Health and to make the world a better place for everyone. So I am Sharif Mohammed Sadat, currently serving as the Regional Director for Asia Pacific at the International Federation for Middle Eastern Association. At the same time, I'm also the founding member of WHO Southeast Asia Regional Youth Council, where we are working on ensuring that there is a youth leadership in global health. And we as youths are taking part in our future because we are the ones who will be the one leading the world in the future. And that's why we believe that as youth, we also have quite a big role in the future of the world, in our policy making, to advocacy, to a lot of fields where we will be the ones deciding what our future will be. So today I will talk a bit about youth leadership in global health and our One Health integrations, how as youths we will be able to take part, So before we move forward about the youth leaderships, let's first get a brief view of One Health. I believe most of you knows a lot about One Health, or most of the things are being covered, but I will just revise a bit to understand how One Health is also related um to our public health fields. Now, let's say One Health. So, according to the Center for Disease Control and Prevention, it means collaborative, multisectoral, and transdisciplinary approach working at the local, regional, and national and global levels. But whatever it is, I don't care about the definitions. The most important thing is the definition that relates to three things. That is collaborative, multisectoral, and transdisciplinary approach. This is something where we need to focus on. This is something where we need to know that this issue is not the issue of just one profession, or like, let's say, just humans. This is something that is related to everyone that is deciding in the society. So to get the One Health approach, it's important for us to ensure that we are working collaboratively with different professions, multisectorally, having different multisectoral approach to mitigate the causes. And that's how we will be able to build a better future for everyone. And this is how we are all related. Now, talking about this, let's see an exact graphical representation of One Health. As we know that it is quite related to environment, animal, and human, but why this has become a public health concern over the years? Now, let's see how it's a public health concern. And first, we need to understand about the zoonotic diseases that links between humans and animals. So these are the diseases that are transmitted from animals to humans, accounting for 75% of the global emerging infectious diseases. And understanding their transmission is very, very important for us for preventing future outbreaks and protecting public health. It's because there we are related to animals, to our like to us like humans. Why? If you as a woman, we think like, okay, we take care of our human health, we take care of the, like, we are leading our life very, very nicely, we're taking just care of us, but we forget about the people around us, like about the elements, about the animals or plants around us. It's not going to make any sense, because we somehow as humans are related to everyone, to the ecosystem of the world. Here, the key examples how they are influencing us. Like, for example, we have Ebola virus, which is transmitted from animals to humans, often causing severe outbreaks in different affected regions. Now to talk about Lyme disease that spreads through tick bites, affecting thousands each year in every region. Talking about avian influenza, which poses a risk to both birds and human populations at the same time, requires ongoing monitoring and research. Like this way, we have thousands of diseases that are coming from animals and plants that are also affecting our health in various ways. These diseases increases due to few severe factors where we as humans are quite responsible on these sectors. For example, if we talk about zoonotic disease increases, the first thing that comes to us is deforestation. How is it related? We have habitat that loss due to deforestation pushes wildlife closer to human populations that increase the risk of diseases spill over from animals to humans, and it increases the exposure to different zoonotic pathogens. We see that like the trees are cutting down in different parts of, let's say, for example, in Bangladesh, we see that like lots of our places where there are hills or trees are being cut down, we are making resorts, or we are making different places for amusements or even for live livelihoods. But then again, there are animals that lives on those places, which comes close to the human populations, because we are destroying their ecosystem, we are destroying their wildlife, and they will have to go somewhere. Sometimes we see in the newspapers that we see the tigers coming from Sundarbans is coming to the different villages and trying to attack different local peoples. These things are being happening because of the deforestations that is been causing, and that where we're decreasing the livelihood, or decreasing the places for the population and for the animals where they live in. The second reason that comes to is the climate change. Climate change alters ecosystem. It changes the natural habitat, the natural ecosystem, which forces the wildlife to migrate and adapt, which can lead to the emergence of zoonotic diseases as a new host pathogen interactions that arises in unfamiliar environments. At the same time, it causes a lot of diseases where these wildlife are being forced to migrate, and then they take up the diseases or take up the pathogens from with themselves and goes to different other places where they migrate. And that's how the animal migration also causes a lot of diseases from different zones to different regions. Like as animals, we are also traveling a lot. We are also being a part of the globalization, where increased global travels and trade facilitates the rapid spread of zoonotic diseases across borders that enhance the likelihood of outbreaks as pathogens are transported to new locations. But how? We as humans are traveling from, maybe let's say we are in Bangladesh and we are traveling maybe to Jordan. So there are some diseases we are also carrying with us when you're going to or traveling due to globalization. So these are the things that has the contributing factors of these zoonotic diseases where this increases. And now let's see how, as youth, we have a role in these sectors in making the world a better place, in making people aware of the One Health approach. We can have three things that I will say we can do. Like for example, I also agree with my colleague that presented in the last presentation, where she was emphasizing on three things that is important for the youth to participate. That is about volunteering, about education, and collaboration. This is very much important, and I will say these are also very much related to the three things I will say are related to youths. For example, research. Young leaders thrive creative solutions to global health challenges through innovation ideas and technologies. And to do research, you need to also be able to educate yourself, and that's where education is also important. And for example, advocacy, we as a youth play a very vital role in advocating for policies that promote health and sustainability worldwide. Here as well, we also need the education and collaboration different of different people across different professions. At the same time, talking about community engagement, we engage communities, helps in awareness and participation, empowering everyone to contribute to better health practices. Here as well, to communicate with, to engage with our community, we also need to collaborate. We also need to have proper education, and most importantly, have the mindset to volunteering, because some things are not just being paid. So sometimes we have to have some roles in our parts to as well to make people aware. And that's how these three things are also quite related to our role as a youths to participate in global health. Now I will talk to you how my organization IFM is also taking part in a glance. So I will just come to a bit about how we as medical students are taking part in these roles. We represent 1.5 million medical students worldwide from 133 plus national member organizations in 123 countries, having been participating in different important roles. For example, we have been working on 6 standing committees that works on mitigating as well as One Health. Like we have standing committee on medical education, professional exchange, public health, sexual and reproductive health and rights, including HIV and AIDS, research exchange, and human rights. And with these integrations, we are also taking a One Health approach to for in our 5 regions throughout the world to mitigate the problems that we have been working. So what we are doing as youths, how we as youths are taking part in the global health educations. We are having capacity building sessions for our students. We are trying to educate. As I said, one of the roles is education. We need to educate first to work on our different projects or collaborations or some things, because if you do not have the idea about what you are working, you will never be able to work in depth. What we did, we have 3 types of capacity building workshops or sessions that we do. We have external led sessions where we invite like externals on experts on different topics from different professions. We also have our peer-to-peer sessions or learning where we learn from our peers. We also invite our alumni who has been there as a part and also taking part in different roles in the future to capacitate our members about different global health issues that has been going on, including One Health. At the same time, last year as well, we also did an activity where we made an interprofessional AMI youth forum with IFMSA with as well as IAAs, IVSA, and IPSF as well. Like we bring together students from different backgrounds of the world to come in front and talk about the AMR approach as well as integrating One Health. It's because of that this it needs a interprofessional collaboration across regions. As doctors or as medical students, we cannot alone do it. We need the help of different professions that are also working in these sectors to educate them, to ensure that all of us are working together, because this needs a working together collaborative approach in order to mitigate the tasks. This is something we we building every year to talk about different problems of global health issues, including One Health, AMR, and so on. Now, what we do as youths, we drive change through collective actions. We as youths take part in different external meetings where we become the youth voices, working together, trying to change or trying to promote different involvements in the policies of our governments or even WHO UN agencies where we have our roles. We play a vital role in advancing the health initiatives, tackling challenges that in disease prevention, environmental conservation, and health education for sustainable community impacts. We drive the advocacy through different meaningful projects. We showcase them. We try to have our trying to integrate different places for youths as well, so that to ensure that there is also meaningful youth participation. It's not just that we are just taken as a tokenism or just to showcase that yes, youth is also there, but also to work together as youths, because this is something where we come from, where we advocate for. We need to engage, because the world, to prepare the world for the future, we also need to have our inputs, to have our contribution in the future of health of the world. These are some pictures from different parts of um, different activities where we have our community engagements, where we as a youth are taking part, talking to different professions, talking to but like engaging in our communities to make sure that they are well aware of different global health issues or problems around the world. And this is how we drive the change. This is how we ensure that our voices are being heard and our communities are being engaged and well aware of the global health issues around the world. So what I want to say is that we don't just advocate, we ensure meaningful youth engagements through community development, through engaging on communities, through engaging different partners, capacity building them, helping them, ensuring that we are well tracked in our causes. And I believe as youths, it's our responsibility as well, apart from our education, apart from our careers, professional life, this is something that we owe to the world in to be able in the future. Because as I said, we are the ones who's going to be leading the future. So if we do not start now, it will be too late, because we do not want the policies in of the future to be written by the people are not who are not going to lead the future. So it's very important for us to be present, to be there, to advocate for the global health issues. So that's all for my part about today's session regarding these. If you have any queries, if you want to know more about IFMSA or any opportunities where you can engage in IFMSA, feel free to reach out to rdasiapacific@ifmsa.org. These are mailing lists. I'm also sending my LinkedIn in the chat as well if you want to connect with me personally. That's all from my side. If you have any questions, feel free to ask about, or I can pass it over to the host.
Powerful presentation, your insights into the role of youth actually in advancing One Health as a youth advocate and global health advocacy are truly inspiring. We actually followed the things you are doing from the medical sectors and the work you are doing to empower young leaders and foster this cross-sectoral collaboration is I think it's vital for the future of our health systems. And I can assure you that our young audience and young professionals have learned a lot from it. Okay, so now we need to move with our next speakers. We have him is Aidul Kabir sir from Bangladesh Forest Department, who will discuss very quick at the as he has some other meetings. Sir will discuss on the intersection of agriculture, environment, and One Health, and his expertise in this area is above 20 years. Will provide us with a clear understanding of how these sectors can collaborate to promote better health outcomes. Let me tell you, sir, first that as a youth advocate, sometimes we struggle to convince environmental studies or related other studies students to attach in One Health sectors. So I think you will have some view on it.
Thank you, Sajjad. May I share my screen with a very Can you see my screen? Is it visible?
Yes, sir. It's visible.
Thank you. I will listening carefully the other speakers who is speaking on this occasion of One Health Day. It's very nice to be here with you. I am Muhammad Jahidul Kabir. I am working as a Deputy Chief Conservator of Forest, Bangladesh Forest Department. I have been involved with the One Health Secretariat and One Health Bangladesh since 2017. And also I have an engagement with the UN Convention on Biological Diversity. I am the subsidiary body bureau member of scientific committee from the Asia Pacific region. So I had this opportunity to be co-chair in the CBD COP, that is the biodiversity and health agenda. So today I will focus on the biodiversity and health agenda in the One Health perspective. I think it is not working. So let me allow time. My screen actually it is not working. So I'll try again. Yes, now I think it is working. So you see the man in the screen. That is our United Nations. The Antonio Guterres. He's here. He's one remark on the eve of the biodiversity day. Biodiversity is the bedrock of life and a cornerstone of the sustainable development. So this is overall the biodiversity. So if you think biodiversity, that the human being, our foundation is the biodiversity. So everything depends on the biodiversity, our life, our livelihood, everything. If you see the environment sector, you see we have the biosphere. There are different biosphere where the biological organism can thrive. This is the biosphere. It may be the atmosphere, upper level of the atmosphere, and beneath the ground. And we have the numerous ecosystem within the biosphere, and we have the biodiversity, flora, fauna, and microorganisms. So this is our planet is depend on, and this Earth, our mother planet, Mother Earth, is facing severe challenges: climate change, biodiversity loss, and pollution. All are interconnected. It is all climate change, biodiversity loss, and pollution is connected. So this triple planetary crisis we are facing, and that have tremendous impact on human and animal health as well as the wildlife. So you see the ecosystem comes very significantly in the definition of One Health that is defined by the OHLF in 2021. So we need to also understand, everybody need to understand the ecosystem, the assemblies of biotic and abiotic components. And there are 5 major components of all ecosystem. That is the composition, structure, function, complexity, and temporal change. We have to understand these 5 basic components so that where is spillover is happening, we'll understand if you understand the component of the ecosystem. So what is the composition? Composition is basically the component of the ecosystem, biotic component and abiotic component. And structure, how they are arranged. This component, you see plant, animal, and other adaptive factors, how they are arranged is the structure, and how they are interacting with each other is the function. What is the dependency of each other, and complexity is the complex relationships among the component of the ecosystem. That one of the component, if we eliminate from the food web or food circle, that will hamper the other species. So there is a complexity among the component within the ecosystem. And temporal change is the ecosystem will, if you or the human being, or if the anthropogenic changes is 0 or anthropogenic intervention is 0, then also the ecosystem will change as per the natural course. So this is the temporal change. Ecosystem will be always changing. So we have to consider this one. And the ecosystem services, you know that these are the services that nature's contribution to people health and people survival. So these are categorized into supporting, regulating, provisioning, and cultural services. So supporting services, we think about the biochemical cycling, water cycle, carbon cycle, nitrogen cycle, sulfur, phosphorus cycling. All are the supporting services. Soil formation, photosynthesis, the vital component of the nature is the photosynthesis that the human being depends on. Regulating services, air quality, climate regulation, water runoff, erosion, natural hazards, soil fertility, and pollination. All are the regulating services that regulate even the human life. The provisioning services, the physical benefit, material benefit we get from the ecosystem, food, fiber, biomass, fuel, medicine, biomedicine, fresh water, all are the provisioning services. And recreational ecotourism, ethical and spiritual well-being is the cultural services. So all these services, ecosystem is supporting human being to thrive in this world, Mother Earth. So you know the health of One Health definition, the ecosystem, plant and wider animal, including need for clean water, energy, air, safe and nutritious food, all have been added in the new definition. So ecosystem and the environment sector comes with a new dimension in the One Health. So I'll now concentrate you the UNF. So UNF is the first organization, the headquartered outside the Europe. It established in 1972, and you know that 1992, the Rio Convention, it have adopted three conventions: Convention on Framework Convention on Climate Change, Convention on Biological Diversity, and as well as the Convention for Desertification. Those three conventions, the UNF is operating. So I'll concentrate on the UN CBD. As you know that CBD adopted Global Biodiversity Framework in 2022, and before this adopting this document, there are several global assessment report on Intergovernmental Panel on Science and Ecosystem Services, the 2019 report. These Global Biodiversity Outlook 5 and many other scientific documents has been consulted and taken into account for this, you see, the Global Biodiversity Framework. And two major assumption is that 25% species so far assessed by the IUCN, mainly IUCN, are threatened, and 1 million species will be extinct in upcoming decades. So this is the major assumption, and the findings for biodiversity loss there are 5 major direct drivers has been identified with this GBF, that is the changing in land use and sea use. We are continuously changing and intervening the land, the present state of land, and over exploitation, climate change, pollution, and invasive alien species. So invasive alien species is the thing that comes as a major driver. Earlier, it was not included as a major driver, but now it has been included as a major driver of biodiversity loss. So depending on these, there are 23 targets of the GBF. I'll not go to detail of the target, but I'll focus on the COP16 that held in 2024 in Cali, Colombia, that have adopted this global action plan on biodiversity and health. So this is a milestone that biodiversity people is thinking about the health, and it is based on the previous talk on biodiversity and health interlinkages conducted in collaboration with the World Health Organization from 2012 to 2021. So this framework is mainly supporting the parties and countries in mainstreaming biodiversity and health interlinkages, international policies, strategies, programs, and accounts, and other things. So now, what are inside this global action plan for biodiversity and health? Assessing biodiversity and health interlinkages. We have vector-borne disease, we have neglected tropical disease, we have spillover, spillback. So what are the interlinkages of the biodiversity? This is very important to find out this one. And encouraging and facilitating national dialogue and knowledge sharing. We have to share this platform, the year platform. This is very appreciating that you are facilitating dialogue, how we can proceed on. Promoting One Health approach and other holistic approach. This document also support One Health approach and urges countries to adopt these approaches. And developing and strengthening national coordination mechanism on biodiversity and health interlinkages. Supporting research on biodiversity. This is very important because we have information lackings. We have gap of information how biodiversity is impacting the human health and animal health. So we need further research and study to identify these interlinkages. And another thing that environmental professional need to be considered if you want to be healthy and keep our animal healthy, we must go for this environmental performance index that would have included in the strategic framework of Bangladesh. So it is like the joint external evaluation of health sector and performance of veterinary services. So like these two sectors, environmental sector have some evaluation system, overall evaluation system, that is the Environment Performance Index. So Environment Performance Index provides data-driven summary for the state of sustainability around the world. And you see that this index uses 58 performance indicators across 11 issues categories. And in 2024, ENPI ranks 180 countries on ecosystem vitality, environment, health, and climate change performance. So within this vital index, in 2024, the situation of my country, Bangladesh, is not very good. So in our strategic framework for One Health Bangladesh, we have added this component 11, health of environment and ecosystem. And what is the long-term outcome of this? The health of environment and ecosystems are should be preserved. And our intermediate outcome, we have fixed that biodiversity and ecosystems protected and restored, and environment performance index that I was talking about, the ENPI, improved to support the health of the people, animals, plants, and ecosystem. So we need to proceed on how the environment performance index will address, and we address in our One Health strategic framework in 3 pillars. Number 1, the ecosystem vitality. If you see the ecosystem vitality, we have several action packages. Number 1, biodiversity strategic output. Number 1, biodiversity and ecosystem conserved, restored, and sustainably used. So this is our strategic output, and under this strategic output, we have included several action packages. And out of these, extended coverage of protected and conserved areas, restored degraded ecosystem. Restoration is one of the important tasks in the forest and environment sector right now in Bangladesh. Increasing sharing of benefit from genetic resources, digital seekers information, and traditional knowledge. This is very important because you see that biological resources have many medicinal value, and so genetic sequence information and DSI information is very important for biomedicine. Important species conservation program. So we have to implement those are extinct and critically endangered species, and threatened invasive alien species management we should introduce. Otherwise, the IS will invade all the areas and destroy our biodiversity and environment. Minimizing human wildlife health conflicts, strengthening. We have a crime control unit, so it is here. Nature-based solution for human well-being. We have to promote this one. This is very important. And management of ecosystem of blue economy. So blue economy, our biodiversity, very rich in biodiversity, and our major protein sources is our ocean. So we have to conserve and restore this one. So ecosystem vitality continue with the strategic output 2, 3, 4, 5, and 6. You see that tree and forest cover increased. A sustainable forest management should be promoted. Sustainable fisheries management promoted. Air pollution monitoring system should be strengthened. Sustainable and safe agriculture practices promoted. This is also important because we are agrarian countries. Major production and coming from the agriculture. Sustainable and safe water resources management promoted. So this is also important, sustainable and safe water resources. And health of the environment, under this component, we keep several strategic output, include air quality, health index improved. So we are in a process of air quality index. And monitoring unsafe sanitation strengthened, and access to safe water increased. So unsafe sanitation is a major problem, as the Bangladesh is a huge population burden, and we have population density more than 1100 per square kilometer. So this is a major problem. Release of heavy metal into the environment reduced. So heavy metal is and hazardous chemical is regularly releasing into the environment. People are using you see various ingredients, even in the auto vehicle, that is battery used in the auto vehicle is creating releasing heavy metal into the environment. sustainable consumption and promoted, and food waste generated reduced. So food waste is one of the problem, and sustainable consumption idea should be promoted. Waste management improved. Our waste management, definitely one speaker put emphasis on waste management, and noise pollution monitoring system strengthened. We need to strengthen our noise pollution. And under the climate change, One Health coordination ensured for climate change resilience. Under these action packages are to promote climate resilient One Health, developing collaboration between public health, animal health, fisheries, aquaculture, wildlife, environment sector on climate resilient health issues, and incorporating health national adaptation plan. So we have health, we are formulating right now national health adaptation plan, and national adaptation plan have already Bangladesh prepared for 2050. So One Health issue and the issue of climate change and health should be incorporated and already incorporated in the national adaptation plan for health sector. So these are the all from the environmental sector. We are working, we are approaching very quickly, and for our better understanding and for our better future of the people of the country. So I'll stop now. Thank you. If you have any question.
Sir, definitely, we have a lot of questions. As you already know that we started the webinar, and the participants registered into the webinar through registration process. So we have a lot of comments from the environment sectors. Okay, so yeah, we would like to ask you 3 questions. As I said that as a youth advocate, when we are trying to attach with the environmental studies or biological studies sectors, they couldn't attach so much from the One Health. In Bangladesh, why does the environment sector still get treated as a supporting actor instead of an equal partner in One Health? So this is the number 1 question. And number 2, that asking from a student from environmental studies, where can we get proper training or opportunities to actually contribute to One Health initiatives equally? So and in an impact-filled way.
Thank you very much. This is very good question. I welcome this question. Number 1 question is that you see the before 2021, the new definition adapted by the Quadripartite, One Health environment component mainly was focused on the zoonotic diseases. So once you talk about the diseases, the environmental professional, rather than the veterinarian and human health professional, they are not the doctor. They are not the doctor at all. So they do not study on the microbiology or other human or animal health related issues. So they do not get interested to study or to learn on the health issues. They want to focus on their environment issues only. So after 2021, this scenario has been changed. The ecosystems comes forward, plant diseases comes forward, and overall other environmental issues comes forward with the One Health agenda. So now I think the situation will be changed a bit, but it is also the duty of the veterinarian and the health professional to learn about the environment and talk about the environment, because environment is the cross-cutting issue. Everybody, we are living in the environment, so disease coming from the environment. So the environmental issue is not only dealt with by the environment professional. Suppose you veterinarian, you find one, you see that anthrax in animal. You have to take the environmental sample, the animal living area, the where they are living, the animal and the animal excreta you are disposing of. So you have to collect the sample, environmental sample from that side. So it is the environment professional will deal it, but it is more appropriate if the veterinary officer or the official collect the environmental sample from that area and go to the sample, send it to the sample for further investigation. And another issues is that the still now in Bangladesh, our One Health and is mainly focused on our activities, mainly focused on surveillance, outbreak investigation, surveillance, and you see joint surveillance or integrated surveillance. So environment professional is not actually habituated with these surveillance activities. They usually do the monitoring. They do not do the surveillance. So that is the activity level differences, and so they do not get interested usually. So we need to reach the environment professional more and more. And as we have reformed or updated our strategic framework, and that strategic framework actually focused on the environment professional is a separate chapter. So once this activity will start, the environment professional will get more and more involved with the One Health activities, and One Health Secretariat, One Health Bangladesh, One Health Young Boys, also they have the duty to reach to the environmental professional to come forward. Once One Health is a part is a health, so one environment student hear the term One Health, so they think that it is not their issues. But we have to break the ice, we have to break the silos and call them to come to the under the umbrella of One Health. This is the answer of the number one question. And number two question, I did not write. What was the number two question? I have forget. Could you please repeat it?
Sir, where they get proper training or opportunities to actually contribute the One Health initiatives in a very meaningful way?
Yes. Very good. We are developing the field training program for wildlife, environment, biodiversity, and ecosystem. That is FTP-OAB program. So FTP-OAB program will taught them how the environment, what is the roles and responsibility of the environmental professional for One Health, how they will contribute in their own professional arena. So from their own professional arena, not only the environment, but other microbiologists, economists, biologists, wildlife professional, botanists, zoologists, all have the role in the One Health sector. So we are going to develop this FTP-OAB program for train the environment professional, how they will understand their role, so that they can understand their role and responsibility and perform accordingly and get interested for the One Health approach. That's from my side.
Sir, you solve a big problem for us. Actually, when we try to influence the environmental studies students, so we have already faced the problem. So I think it's truly insightful for all the environmental studies students here. And thank you for your commendable sessions with us. So
Thank you.
we would like to move our next speakers. Actually, sir, we have Dr. Ibrahim Khalil, sir, the Department of Life Service of Borishal, Bangladesh, a prominent figure in local health initiatives, whether it is rabies, influenza, or any other surveillance thing came out through the initiatives. Sir will be there. So through youth involvement. He is also serving as a advisor of Bangladesh Radiantself community and also Bangladesh Youth Health Alliance. Sir, please share your expertise with us.
Thank you, Shajad. Am I audible?
Yes, sir, we finally hear you.
Okay, thank you. And thank you to the participants as well. And you all are enjoying the webinar today for a long time. I think I can finish the presentation within time. So thank you very much. And already Sadat introduced me and me, Dr. Ibrahim Khalil, working as a senior scientific officer at the Field Disease Investigation Laboratory in Borishal. So first of all, I would like to give a statement that I believe we have no lack of resources. We believe we cannot use our resources. Why? because we are not using our community people, we are not using our youths. Therefore, my presentation will be from awareness to action, youth-driven One Health initiatives in Southern Borishal. So I'm working under the Borishal model. You may know that the Borishal is the southern part of Bangladesh, and basically I'm working in four parts in Borishal that under the Borishal model. One is biosecurity interventions at the farm level. The second one is participatory mapping and experimental game at live bird markets. Thirdly, youth engagement and One Health team establishment in the southern part of Borishal. And fourthly, the AMR surveillance. So, but today I'd like to describe about the importance of community people engagement to reduce the AMR burden as well as the youth involvement to reduce the AMR burden and zoonotic disease as well as. We know the importance of the community people because the community people have the local ownership and they have the practical local knowledge and trusted social networks as well. And in my next slide, sorry for the interruption. Yes, in the different study of the different country proved that the importance of the community people. One statement is that cultural beliefs are not superstition; is the identity. Health advice must respect and integrate culture for success. If doctors ignore or dismiss these beliefs, people may ignore the doctors. So, participatory approaches improve adaptation and leads to higher trust and sustainability. So, through this slide, you can understand the importance of the community people. And we know the potentiality of youth as well as it's a low cost initiatives and they have no need effective outreach, volunteer networks, youth power for rapid engagement and increased community trust. So I am briefing a study that is participatory system mapping and experimental games to explore biosecurity adaptation in broiler production in Bangladesh. So AMR is not a new thing in Bangladesh. We know very well. And in this slide, you can see the maximum antibiotics are 100% resistance. And we completed this study in a model poultry village that is situated in Borishal. And why the marginalized farmers are using antibiotics? Because they have belief. What the beliefs? They believe broiler production is impossible without antibiotics. The second one is antibiotics can prevent diseases from entering. And thirdly, biosecurity management is very costly. Therefore, we completed several trainings, so workshops among dealers, farmers to change their belief. We would like to close the door for germs. We should focus on the biosecurity adaptation to change the beliefs among the marginalized communities. So we arranged a meeting in the yard of the farmers. First, we are looking for we are asking for a map from the farmers. They drew everything of the village, like house of the farmers, roads, trees, paddy field, and mosque, everything. And then we ask two questions. One is, which diseases are the most common? And they told different type of disease name. Basically, they told the signs of the diseases. And they used the local language like Tuna Haga for Newcastle disease. Tuna means white. Haga means feces. Tuna Haga for the Newcastle disease. Shobuza means greenish feces for fowl color, like that. And then we ask which farms was affected first. And they identify the trend, actually how the disease visited their farms. And the approach is we called it participated disease searching, and we called it U2C, Upazila training approach. We got the training support from the FAO Act at Bangladesh. And we made a timeline of the disease, and we focused on the how and when, and what the impact of disease. And we would like to find out the index or fast cases of the disease. And the interesting thing is about the training part. This is how actually we share our ideas, share our information among the farmers. You know that the farmers are not knowledgeable so much. Like that, first we introduced about the lipstick theory. How we secretly rubbed lipstick on participants' hand and asked them to shake hands with everyone. Afterwards, we asked the participants to observe their hands. They noticed lipstick marks on their skin and were surprised by the result. Through this experiment, they can understand the germs can spread just with my hands. Another example of our training program, that is chili powder exam. How actually we are doing that? Rub chili powder on their hand, shake it off and whip with tissue, rinse with clean water, wash with soap. After each step, we ask, can you touch your eye now? Participants feel safe only after washing with soap. Through this training, they can easily understand germs cannot ripped out without disinfectant. Only the water cannot remove the germs. So through these interactive games to demonstrate what germs are and how they spread. And we told about the germs. It cannot walk, cannot fly, cannot swim. They can transfer through hands, shoes, vehicles, and visitors. So they can easily correlate how actually germs are visiting our farms. And we demonstrated wet cleaning and dry cleaning of feeder and water. And you easily see that what was the condition before training of feeders and waters, and what was the next condition of feeder and water. Surprisingly, they found the maggots in the feeder, and they understand that what is the importance of proper cleaning of feeders and waters. And the next, what are the surroundings of the farmers before the training, and what are the surroundings of now? So you can easily differentiation of the farms. So basically, after the completed our training, we give two options. Option A, regular practice and depend on antibiotics. And then option B, rare without antibiotics. That is basically biosecurity based. We tried to share 12 biosecurity scales, and we completed 4 cycles. That 4 cycles means 4 batches of broiler production with 10 farmers in a village. And we did a causal loop diagram where co-created with farmers, dealers, and veterinary officers. And we identified some balancing loop and reinforcing loop. I am skipping this slide. Come to the slide. This is the baseline data of the adapters and non-adapters. Interestingly, the adapters and non-adapters both have the mortality rate, and the FCR was near to same, and they have outbreak history, and they have the antibiotic is frequency like 4 to 5, and they have the biosecurity scale maintaining practices. Interestingly, the adapters who actually believe on our biosecurity dependence, they are not good condition than the non-adapters condition. Although non-adapters condition is slightly good condition than the adapters, but they are not following they are following our rules with they cannot agree to rear their birds without antibiotic. And what I found after the 4 cycles of their bases, the mean value of the biosecurity are increasing in both groups. So red color for the non-adapters, that is antibiotic dependence. The green color for the adapter groups and biosecurity base, and improving their, and the mortality decreasing in the adapters group. FCR is, that is food conversion ratio. The efficiency, food efficiency, basically feed efficiency. And they have no antibiotic history, and they have no disease outbreak history. Interestingly, the non-adapters groups who are still using antibiotics, they're improving. Why? Because they are start following the biosecurity. So through this game, they easily understand what is the importance of the biosecurity tools, and how we can relieve the antibiotics in our production. And this is after the completion of our study, we did antibiotic sensitivity testing again to the adapters and non-adapters group. We found resistance decreased by 8% among adopters in the round 4. And we invited a successful farmer to tell his story at the second One Health Youth Symposium in 2025 also. And we did some PCR and identified some AMR genes as well as that. This is the most important slide. Before the starting, the farmers believe it is totally impossible to rear broiler without antibiotics, but they start their business with the antibiotic-free meat to the consumers directly. And when they shared this message to the Facebook, in the social media, and some farmers asked, is it possible to rear broilers without antibiotics? And now the farmers are sensitizing other farmers. They told, not only antibiotics, you can broiler without any medicine. This is the belief change, belief changing. This is the attitude changing of farmers. What actually we was looking for. And we are working with to establish the One Health team in the southern Bangladesh. And this is the team of the professionals group, and this is the team of the youth group. And we are trying to sensitize in other institutions like Shere-Bangla Medical College, Patuakhali Science and Technology University, Chittagong Veterinary and Animal Sciences University, and the National University in the southern part of Bangladesh. And we are hiring some volunteers to do research in the southern part. And interestingly, sometimes some people say that without fund, it is impossible to do research. But interestingly and importantly, we are doing 15 volunteer projects without any fund by engaging youth and other collaborators. So we think collaboration is power, and youth have the lot of potentiality to do research and other works. And we are arranging some training programs for the youth professionals on the basic ArcGIS mapping, basic data analysis, methodology, as well as already we have completed near to over 500. We have completed 500 training programs. And then this is the last slide. There is a good scene, but it is hindered by a poster of antimicrobial resistance. But we would like to enjoy this scene. So, no resistance to fun, resist zoonotic disease and AMR. Therefore, we need One Health initiatives with engaging the community people and the youth. Thank you very much for inviting me. And it is a very great pleasure for me to advise the youth community, Bangladesh Radiantself community. You can engage, you can connect with me through LinkedIn. Just scan the barcode. Thank you very much.
Thank you, sir, for your real approach and insightful learning for the young professionals and all the audience are present here. We strongly believe that actually local health initiatives are indeed a foundation upon which we can build a healthier world. And your immense working on the day by day on it, someday we will reach the spot we are desired for. So as we approach the conclusion of our webinar, I would like to thank all of our distinguished speakers for their invaluable contributions and insightful learning for this webinar. I think it has a privilege to host this session and hear from the experts across different fields of the world. And before we close, I'd like to remind everyone to take part in the upcoming survey and our youth initiatives and movements by this to continue to advance the One Health approach globally. Thank you all the participants who joined us today. So before we leave, I think we need to take a small screenshot by the organizers. Please, I'm allowing all of you to start their video so that we can take our moment in memories. So please, if possible, open your camera. Yes, I'd like to our organizers, please take the moment so that we can share this from all over the world so that the youth engagement can bring some impact in our society. And we are eagerly waiting to change the world and make some contributions through One Health and leave some advocacy for the future generations. I'd like to Yes, I would like to request all the participants here. Please open your camera so that we can take them moments as a memory. A lot of participants are coming. Can I just please take a look on it? It is truly inspiring that we will have we will organize for future partnerships and collaborations that so that our youth can learn something from it. And let's take a moment to reflect all the powerful discussions we had and from Professor Dr. Devnath, Dr. Randa Bazi, whether it is from the young brilliant mind, Dr. Sadat Ekadesai, and from the government perspective of Bangladesh, Dr. Khalil and Dr. MD Zahidul Kobe. So this webinar hasn't just been a series of speeches. It has been a testament to the comprehensive collaborative nature of the One Health approach. It proves actually that no single discipline can solve the complex challenges we face, whether they are zoonotic diseases, climate change, or emerging threats. So the future success of public health actually rests on the shoulders of this kind of cross-sectoral partnerships. So our incredible speakers thank and all the audience, your passion, your time, your contributions were invaluable. And thank you once again for your active and engaged participation. Your presence this demonstrates the shared commitment to this vital mission. And we believe that we leave this session today inspired, connected, and commitment to a future where the One Health approach is not just a concept, but fully embraced. Okay, so integrated reality and where the youth contribute to lead the church toward a healthier, more sustainable world for all. Thank you, everyone. I wish you all a safe and productive evening today. Thank you for joining with us.